Welcome back. This is our second video today. We've aired a video last week on oral health tips for people working from home. And just a reminder, my name is Brittany Tibbetts. I'm a registered dental hygienist in Phoenix, Arizona. In case you missed last week's video, I just kind of shared some information on my background. So I work in private practice a couple days a week, and then I also work for the county as a public health hygienist. So I see kind of a wide range of patients from very, very young, their very first dental appointment, all the way to seniors. And I really like working with seniors. That's our topic today, is how to care for older adults and seniors. I really like working with them because the same problems that affect younger adults and kids also affect seniors. So the three most common things that we see in older adults are cavities, dry mouth, and gum disease. So they kind of require some special attention and instruction. So I really like working with the older population. And I just wanted to share some tips with you guys. So maybe you have older parents at home, or maybe you're in that older population and you just need some help, or just ways to kind of tweak your home routine and make sure that you're doing everything you can at home to make sure your oral care is being addressed. So just a reminder, I'm partnering with Delta Dental. So I'd be happy to answer any questions you guys may have. Feel free to drop a question in the comments. If you've got something that you want me to talk about or get back to you later, I'd be more than happy to do that. The only thing is, I just want to remind you that we can't address any specific questions that you have about your particular insurance plan or your dental coverage. You'll want to contact our customer care team for that. And I think we're leaving their phone number in the comments section, so you should see that come up here shortly. Okay, so the first, I kind of made myself some cue cards here, just I didn't want to miss anything. But the first tip that I wanted to share with you guys is how to care for either your mouth or somebody else's mouth if you have dexterity problems. So a lot of times our older adults have arthritis, and it's really hard for them to make a really tight fist, especially around like a manual skinny toothbrush. You see how kind of skinny this handle is. So best tip that I have for you guys, if that is the case for you, is to maybe switch to an electric toothbrush. You can see the difference in the handle. So it's a lot easier for you to kind of wrap your hand around a wide-handled electric toothbrush versus a manual one with a really skinny handle. The nice thing about the electric toothbrushes too is if you have problems, maybe some limitations in range of motion, things like that, it does a lot of the manual action for you. So you just kind of have to place it in your mouth, make sure you get the outside and inside surfaces of your teeth. So make sure you're focusing right at the gum line there, and then rock it back to the inside surface. So it kind of does the action for you, so you don't have to worry about really getting in there and scrubbing. We also have, I brought an example of a water irrigator. So this is really helpful if you have a hard time with flossing. It can be a challenge for people with dexterity issues to kind of wrap that floss around and get all the way in those back molars there. So this just helps a lot with that. You basically just fill the handle with water and place it right in between the teeth along your gum line and allow this to do the action for you. It just kind of shoots away some of the food debris and plaque and bacteria and stuff that kind of hides in those crevices. So this makes life a lot easier if you do struggle with flossing. They also make fun little floss picks. They have a toothpick on one end and then the floss strung between them on the other end. This makes it a lot easier too. That way you're not trying to wrap that little stringy floss around your fingers and kind of get them back there. They also have things that are kind of like this, but they come on a really long handle. So if you still find that this is a challenge, getting your fingers all the way back there to get those back molars, you can maybe look for something that's like that but has a really long handle. You can find those products like over the counter at grocery stores, Target, wherever. When you're trying to find products, it's not a matter of like how much money you spend. You don't have to go out and buy the most expensive toothbrush or expensive water flosser they make, so long as it suits your needs. So long as it has a handle that you think you can grip and use, be able to get those inside surfaces and outside surfaces as well. So long as you think you can use it, fine. It doesn't matter. You can spend as little or as much as you want on a toothbrush. Same thing with the water irrigators and floss. Let's see, the water irrigators, so they come in a couple different styles. They have ones kind of like this where you just add the water to the handle. These are really nice because it's just a nice handheld thing, or they make some that sit on your counter that have like a water tank with them. So whichever you think would work better for you, whatever you're more likely to use is the one that I would recommend. So that's kind of my tip for those people who struggle with dexterity issues. The next tip that I have is what to do if you have dry mouth. So this is really common in our aging populations, and usually it's because of medication. So as we get older, we often see an increase in the amount of medications that we're taking, and there are some really common medications that a lot of older adults are on that have oral implications, specifically dry mouth or xerostomia. Statins, medications that you take for high blood pressure, diuretics, calcium channel blockers, things like that. Those medications all can cause dry mouth. And so if you find that you're on those medications and you do experience that dry mouth, I'll give you some tips and suggestions on different products that you can use to help alleviate that. Also, as we are kind of in allergy season, a lot of antihistamines, those types of allergy medications can cause dry mouth as well. So they're trying to dry up your mucuses, but in the meantime, they also dry up your salivary glands too. So they make some really great over-the-counter products that help with that. They don't completely get rid of the problem, but they do definitely help, so long as you're using them consistently. So they make a lot of over-the-counter rinses. Biotine comes to mind. That's a good one that helps alleviate dry mouth. Make sure you're using it consistently. They also make a spray. I like this spray because you can either carry it in your pocket or your purse or whatever, and just give yourself a couple little spritzes if you notice that your mouth is feeling dry. It just kind of helps lubricate and moisturize your tissues and help soothe them as well. They also make little dissolving discs. Xylomelts are ones that I'm thinking of. You just place them on either side of your parotid salivary glands up here, and they just kind of dissolve and stimulate your saliva glands throughout the day. So those are really helpful. Let's see. They also make xylitol. So make sure that if you're chewing gum or things like that to help stimulate your saliva, make sure that it has an ingredient called xylitol in it. Xylitol is just a natural plant-based ingredient, and it helps to stimulate saliva, but make sure that your gum is sugar-free. And then the final tip that I have in this particular category, the dry mouth category, is to talk to your dentist and figure out if they think that fluoride treatments would be appropriate for you. So those can come see if they have any other specific product recommendations, but those would be my tips for you guys. The next topic that I want to discuss is people who have removable appliances, so like dentures, partial dentures, things like that. Basically, we're going to talk about how to clean them and why not cleaning them can cause problems. So how to clean them. So you want to make sure that you take them out after meals and rinse them under water to make sure you get any loose debris, food debris, things like that off of them. You want to use a soft bristled toothbrush. Make sure it's a soft bristle and not a hard bristled toothbrush. And just kind of gently rub over them. You can use a little bit of a soapy water mixture too, but you never want to use toothpaste. Toothpaste has really abrasive particles in it that can actually damage your denture over time. So just make sure you're using either mild soapy water or just water with a soft bristled toothbrush to kind of clean off any loose food debris. And then you want to make sure that you store them in water overnight, either water or a denture cleaning solution. You don't want to leave them just on the counter dry because it can distort them and change the shape of them. And so you might not get that same tight fit that you want in a partial denture or full denture. If you don't clean your dentures, a lot of bacteria can be found on the palate surface of your denture, and that bacteria over time can cause irritation in your gum tissue. We also see things like thrush happen in the mouth, which is basically just like a yeast fungal infection. So you want to make sure that your tissues breathe at night and you're not wearing them 24/7. Take them out at night and store them in a solution. It's really important to update the dentist or your hygienist of any changes in your health. So when you go for your recall appointments or your cleaning appointments or checkups, you want to make sure that you let your dentist or hygienist know of any changes. It's really important because we need to make sure that we're safe when we're treating you. So if you maybe had a heart attack recently or were hospitalized within the last 6 months, we need to get clearance from your primary doctor or your cardiologist to know that it's safe for us to perform treatments on you. Let's say, for example, you had a joint replaced, like a knee or a hip or something like that. Oftentimes we need clearance from your orthopedic surgeon, and sometimes they even want you taking a prophylactic antibiotic before procedures too. So it is really important that you let us know that you have had either procedures or medications, things like that. Tip 5, so know what a true dental emergency is. So we got some information from the American Dental Association's website, and I kind of picked a couple that are geared more towards older adults. And so emergencies, reasons why you would want to visit a dentist include defective restoration work. So maybe you had a crown that fell off or that chipped or isn't fitting correctly. Or if your dentures need adjustments or repairs, maybe if your denture is loose or a tooth broke off, something where it's not functioning properly, you definitely want to get to a dentist and have them address that for you. Call your dentist right away, don't wait. I know it's recommended that we postpone elective dental treatment right now during this coronavirus outbreak, but those would be considered dental emergencies, and so you do want to get to a dentist right away. Tip 6, this is for women, and this has to do with what to do when you're going through menopause. So we know that low estrogen can cause bone loss and receding gums. So it's really, really important that you continue to brush at least twice a day and floss every single day. And then you also want to try to increase the amount of calcium that you're eating. So calcium-rich foods like broccoli and cheese and dairy, things like that. Maybe try to start incorporating more of that stuff into your diet. That way you don't miss out on some of those really important minerals. You can check out the Delta Dental of Arizona blog and search healthy recipes for easy calcium-rich foods. And we've posted a couple of different recipes on there to help you incorporate some of those calcium-rich foods into your diet. One other tip that I want to share too is a lot of women are taking medications for osteoporosis, bisphosphonates in particular, and we do know that in very rare cases, these can have some major implications in your jawbone. So it's really important to get to the dentist regularly for your checkups and cleanings and exams, and allow them to take radiographs as needed just to monitor for changes, check for any abnormalities, things like that in your jawbone. It's really important. And the last tip that I have for you is to call and check up on any older adults that you have in your life. Grandparents, parents, aunts, uncles, things like that. We need to show them a little extra love right now. A lot of them might not be so tech savvy, so they don't have the opportunity to video chat with them or FaceTime or whatever. So just pick up the phone, make sure that they're okay. It also would be a good idea to just ask how their mouth is feeling, if they have any sore spots or issues or anything. Maybe share some of the tips that you learned today with them and see if that can help them. Also, if you have a loved one that's living in a care facility, maybe check with the staff just to see what they're doing to help them with their oral care. Maybe even give the staff some tips on ways that they can improve their oral care, and just make sure that everything is going well with them. Let's see. I think those are all the tips that I had for you guys today. And so anyway, just keep an eye out for us. We're going to be coming back to you next week with another live video, and we're going to share some information about what to do with kids. So that's also another really fun topic. It'll be the same time next Wednesday at noon. So please join us, and we'll see you next week, and happy brushing.